So good morning, good afternoon, and good evening to everyone. My name is Federico Martire, and I am the director of the European project Bridging the Gap 2 at FIAP Spanish Cooperation. Welcome to one and all to our virtual conference, Disability Inclusion in International Cooperation, the Way Forward. Bridging the Gap is an initiative aiming at the socioeconomic inclusion of persons with disabilities in 5 low and middle income countries, namely Burkina Faso, Ethiopia and Sudan in Africa, Ecuador and Paraguay in Latin America. BTG is funded by the EU and implemented by a consortium of 7 partners led by FIAP. The project works to strengthen the capacity of public administration and the organizations of persons with disabilities in said countries, and to impose more accessible and inclusive public policies in line with the principles of the UN CRPD, nothing about us without us, and of the Sustainable Development Goals, to leave no one behind. BTG focuses as well on reinforcing the mainstreaming of disability inclusion in international cooperation, and notably in the European Union, to help make it become an integral part of development cooperation policies and programs based on the human rights and twin track approaches. This is our topic for today's session, during which we will explore the contribution of BTG to the reinforcement of disability inclusion in international cooperation, and in particular in the work of the project partners, now that BTG approaches its conclusion set on August the 2nd. Over the past 4 years, BTG has served the global momentum for inclusion's way, enhancing the role of the consortium members as primary actors of disability inclusive cooperation. Overall, the project has organized 52 global workshops, webinars, and trainings with around 2,000 participants in total, launched 10 communication and visibility initiatives, having gathered almost 600 people, published 41 documents, 1 photo book, and established important synergies with other EU implementing partners programs. Building upon this experience is paramount to both consolidate the inclusion of persons with disabilities in development policies and to spearhead new innovative initiatives to the challenges the future will bring. And of all this, we will be listening in a few moments from our panelists. Before getting into action and dwelling on today's agenda, allow me a few moments to thank all speakers who have accepted our invitation and also their availability to move around the agenda, as well as to the extraordinary project team who has incessantly worked for the organization of this conference, and notably to Carmen, Alessia, José Luis, and Jimena. Thanks also to all the consortium members, with a worthy mention for our colleagues from IFID Ecuador who have given us technical support for today. Finally, I wish a good work session to the interpreters and the captioners. Thank you in advance. And now, with no further ado, I will move on to our first distinguished guest and panelists for today. And I have the pleasure to introduce you to Ms. Anna Terroncusi, Director of FIAP. Directora, tiene usted la palabra.
Hola.
Sí, le escuchamos, pero no le vemos.
Y cuando intento abrir la cámara, me dice que el anfitrión no me permite. Ahora me dice que el anfitrión me pide abrir el micro. Aquí estamos. Aquí estamos. Muchísimas gracias a Federico. Muchísimas gracias a todos, apreciados miembros de este panel de inauguración, queridísima Carmen. Dejadme decir, en primer lugar, que tengo un día de sentimientos encontrados porque realmente el trabajo hecho por Bridging the Gap hasta ahora ha sido mucho. Las lecciones que hemos aprendido, y volveré un segundo sobre esto, han sido muy importantes, no solo en términos de desarrollo del programa y no solo para los beneficiarios, pero también para nosotros. Y esa idea de que hoy es el momento en el que vamos a sacar conclusiones, y la idea de que por lo menos este proyecto, este programa tal como lo conocemos y en esta fase llega al final, bueno, me produce esas sensaciones dobles, ¿no? De mucha alegría y de reconocimiento de la relevancia de lo que hemos hecho aquí, y no de tristeza, porque espero que realmente podamos avanzar en el trabajo en este área. Desde FIAP trabajamos sobre todo para mejorar las políticas públicas y la administración. Y creo que en un ámbito como el de la cooperación inclusiva y el de la inclusión de personas con discapacidad, las políticas y las administraciones son extraordinariamente relevantes, son más relevantes aún que en otros casos, ¿no? Nosotros decimos que estamos intentando, desde la cooperación europea y desde la cooperación española, trabajar con el conocimiento público, transmitiendo unos valores y transmitiendo una idea de justicia que queremos que sea la seña de identidad de lo que estamos haciendo, la seña de identidad de nuestra cooperación. Eso se verifica sobre todo cuando trabajamos para incluir a personas con distintas vulnerabilidades y para hacerlo de forma consciente para que el resultado de estas políticas públicas, para que el resultado de las acciones sea igual para todos. Para que ese resultado sea igual para todos, no podemos trabajar igual con todos. Ser inclusivo quiere decir saber qué tipo de gobierno, de gobernanza y de administración llevamos a cabo para que esto sea posible. Bridging the Gap se ha considerado un programa piloto, ¿no? Yo me voy a avanzar porque creo que lo puedo hacer porque he seguido muy de cerca lo que ha ido haciendo el proyecto. Me voy a avanzar en decir que sea lo que sea las lecciones que se pongan de manifiesto hoy como lecciones aprendidas, sean las que sean aquellas o sean los que sean aquellos resultados, el impacto que haya tenido el programa, creo que todos estaremos de acuerdo en la absoluta necesidad de continuar de una forma u de otra trabajando en esta cuestión. Yo quisiera decir 4 cosas hoy y aquí de Bridging the Gap. Una es que ha sido seguramente una buena práctica que ha empezado a trabajar desde la idea, entendiendo como una manera y un espíritu desde el que trabajar, ha empezado a trabajar desde el principio con la idea de Team Europe, con la idea de juntar, en este caso, a España, a Austria, a Italia y a Finlandia, pero también los países donde como cooperación europea hemos trabajado. Este espíritu creo que se ha notado a lo largo de todo el programa, que ha permitido no solo unir a estos actores de la cooperación europea con a los países de América Latina y de África con los que hemos estado trabajando, sino también con sociedad civil, con otros actores que realmente han reforzado mucho ese tipo de cooperación, ¿no? Además, yo creo que este modelo de éxito, bueno, pues ha permitido la aplicación de los principios de la Convención y una serie de otras cuestiones técnicas en las que no voy a entrar ahora porque lo van a hacer ustedes de una forma mucho mejor y a lo largo de todo este día, ¿no? Hay algo que sí quiero decir porque me parece importante. La complementariedad de Bridging the Gap con otros programas que hemos llevado y con otros programas liderados por nosotros y por otros, el impacto que ha tenido trabajar en Bridging the Gap para FIAP como organización, y no siempre pasa, no siempre podemos apropiarnos de algo que sucede en el marco de un programa para mejorar nosotros como organización. Por lo tanto, creo poder decir que eso ha sido así, ha sido una realidad y espero que también se verifique por parte de otros actores, pero desde luego para FIAP lo ha sido y de una forma importante. Nos ha hecho llegar a la conclusión de que teníamos que inscribirnos en el marco de las organizaciones internacionales que estaban trabajando esta cuestión y de las federaciones que estaban trabajando en esta cuestión, y ahí la membresía y la participación en la red GLAD ha sido la verdad importante, y el impulso del International Disability Alliance ahí ha sido clave. La idea también de poder trabajar con dos espacios geográficos diferentes y aprender uno de los otros ha sido también para nosotros muy gratificante, y ver cómo siempre nos focalizamos en las diferencias, ¿no? Pero también existen las similitudes y aquellas cosas que trabajando en entornos distintos nos hacen ver que las cuestiones son idénticas y que la capacidad de aprendizaje implementándolas en dos áreas geográficas diferentes, pues nos hace aprender más y más rápido. Yo lo dejaría aquí. Felicidades a Federico, felicidades a todo el equipo, gracias a nuestros partners, gracias a nuestros partners europeos, latinoamericanos y africanos, y yo solo espero que esta experiencia, desde luego, no se desperdicie, que se proyecte hacia el futuro y que podamos continuar viendo cómo el conjunto de la cooperación se enriquece con esa experiencia de inclusividad y cómo podemos trabajar en el futuro para mejorar también la gobernanza, los sistemas públicos, la incorporación en ellos de la sociedad civil y también el gobierno, porque no es solo la gobernanza, es cómo los gobiernos incorporan y cambian. Gracias a las tecnologías volveré al acto de hoy, que se está grabando, pero tengo que acabar mi intervención diciendo que lamento mucho no poder quedarme a escucharles, pero teniendo esta en agenda desde hace tiempo, ha habido cosas sobrevenidas que me van a obligar a dejarles ahora. Volveré aunque no sea lo mismo, a escuchar a mis colegas de panel en la inauguración y a los demás de forma enlatada. Seguro que Federico me va a facilitar que pueda hacerlo. Muchas gracias, adelante, hasta muy pronto. Y bueno, me olvidaba por obvio y omnipresente, pero desde luego no quiero dejar de mencionarlo, del trabajo que hemos hecho con la comisión, de las facilidades, de la permanente presencia. Nos consideramos parte de la cooperación europea y espero seguirlo siendo y seguir trabajando en este y otros programas. Muchas gracias. Gracias a todos.
Muchas gracias a la directora de la SIAP, Ana Terroncusin. Ana, me sumo evidentemente a las palabras, agradeciendo por los agradecimientos y sí, por supuesto, tendrás oportunidad de seguir en nuestro evento, sea más tarde o a través de las plataformas, otras plataformas digitales, que es muy importante destacar un mensaje, por lo menos de la directora, esta iniciativa de carácter europeo amplio, en el que instituciones europeas, Estados miembros, 4 en particular, España, Italia, Austria, Finlandia, organizaciones de la sociedad civil, países beneficiarios, pues suman fuerzas para lograr resultados, en este caso, en el desarrollo inclusivo. Una forma, de cierta manera, innovadora, que seguro va a representar una manera de trabajar con la que sigan en el futuro. Así que muchas gracias a la directora de la SIAP, Ana Terroncusin. Y ahora, sin más, tengo el placer y el honor de cederle la palabra a la segunda ponente de nuestro panel, Carmen Castilla Ruiz de Velasco, directora de Cooperación con América Latina y el Caribe de la Agencia Española de Cooperación Internacional para el Desarrollo, AECID. Muy buenas tardes, Carmen, directora.
Y muy buenas tardes desde Madrid, buenos días en América Latina y el Caribe. Muchas gracias, Federico. Muchas gracias a la Unión Europea por organizar este evento de balance, puesta en valor del recorrido realizado. Permítame saludar a los panelistas con los que participamos en esta apertura de esta jornada y enviarle yo también un caluroso saludo a Ana Terrón, que lo recibirá aunque sea posteriormente, ¿no? Yo quería comenzar recordando algo que es evidente y es el compromiso de España con los derechos de las personas con discapacidad como parte fundamental de los derechos humanos, no solamente en el ámbito nacional, sino también en nuestra acción exterior, ¿no? Y en esa acción exterior, el papel de la Agencia Española de Cooperación Internacional para el Desarrollo, de la AECID, ha sido profundamente activo, ¿no? Contamos con una guía para la inclusión de la discapacidad en la cooperación para el desarrollo. Hemos incluido la discapacidad en nuestras actuaciones de emergencia y de ayuda humanitaria y también de manera transversal en nuestros programas de cooperación. Además, hemos incorporado la perspectiva de género, que como saben es una seña de identidad de la cooperación española, a esta dimensión, a este ámbito de los derechos de las personas con discapacidad y al igual que a todas nuestras actuaciones en materia de derechos humanos, con el objetivo último de cumplir con nuestro compromiso con la Agenda 2030 y con ese objetivo compartido de no dejar a nadie atrás. Me gustaría mencionar brevemente algunas actividades concretas que hemos apoyado, por ejemplo, en alianza con la Red Intergubernamental Iberoamericana de Cooperación para la Educación de Personas con Necesidades Educativas Especiales. Hemos celebrado celebramos anualmente las jornadas de cooperación educativa con Iberoamérica sobre educación especial e inclusión educativa, que suelen tener lugar en algunos de los centros de formación de la ECID en América Latina y el Caribe. También desde 2019 y con el objetivo de promover la accesibilidad universal en los municipios latinoamericanos, venimos participando en la concesión del prestigioso premio Reina Leticia de Accesibilidad Universal. Por otro lado, y en el ámbito de nuestra actuación multilateral, desde la ECID y en colaboración con el Fondo de Población de las Naciones Unidas, desarrollamos el proyecto We Decide, que como saben está focalizado en la prevención de la violencia ejercida contra mujeres jóvenes y en particular contra niñas con discapacidad, ¿no? Y además, desde julio de 2019, la ECID es una de las 33 instituciones del mundo que participa en la red GLAD, a la que también se refería la directora de FIAP hace unos minutos. En el ámbito iberoamericano no me gustaría dejar de mencionar por su importancia, el programa iberoamericano sobre derechos de personas con discapacidad, un PIPA que fue aprobado en la Cumbre Iberoamericana que se celebró en Guatemala en 2018 y que busca contribuir a la inclusión efectiva de los 90 millones de personas con discapacidad en la región, con un enfoque de desarrollo, de integración, evidentemente de derechos humanos, en la formulación de políticas públicas para las personas con discapacidad. Me gustaría señalar la activa participación de España, no solamente en el impulso de ese nuevo programa, sino en su gestión diaria. Cabe recordar que la unidad técnica de este programa lo ostenta la ONCE y, por otro lado, España participa evidentemente a través de la Dirección General de Políticas de Discapacidad de nuestro Ministerio de Derechos Sociales y Agenda 2030. Toda esta actuación que desarrollamos desde la agencia es muestra de un compromiso que hemos podido también de alguna manera aterrizar como señalaba Ana Terrón, con un enfoque de alguna manera anticipado, ¿no? de lo que es hoy ese equipo Europa en el que tanto creemos, que es Bridging the Gap, el programa Cortando Distancias en su segunda fase, ¿no? Evidentemente este programa nos ha permitido, con la alianza de la FIAP, bajo ese enfoque de Team Europe, pues desarrollar una serie de actuaciones en materia de defensa de los derechos de personas con discapacidad en dos países prioritarios de la cooperación española, como son Paraguay y Ecuador. Hemos podido aportar desde la ECID, además de nuestra experiencia de trabajo en materia de inclusión social de personas con discapacidad, evidentemente nuestra larga y sostenida trayectoria de cooperación con esos dos países, con Paraguay y con Ecuador, nuestra presencia en el terreno con oficinas técnicas de cooperación y una amplia capacidad de interlocución con instituciones públicas y con sociedad civil ecuatoriana y paraguaya. Además, en este ejercicio yo creo que es uno de los aspectos más positivos y que me gustaría resaltar. Hemos tenido la suerte de contar con el apoyo técnico de organizaciones españolas de referencia en materia de derechos de personas con discapacidad, como son CERMI, o con CENFE o FOAL de la ONCE, que son socios estratégicos de la cooperación española en este ámbito y sin cuya participación yo creo que los resultados no habrían sido tan positivos, ¿no? Me voy a referir únicamente muy brevemente dos apuntes sobre los proyectos en Ecuador y en Paraguay. En Ecuador nos hemos centrado en temas de inclusión de discapacidad en la educación pública. Hemos logrado firmar un primer convenio entre el Ministerio de Educación y las organizaciones, o hemos promovido la firma de ese primer convenio entre el Ministerio de Educación y las organizaciones de personas con discapacidad en Ecuador, un convenio que ha permitido trasladar acciones y resultados concretos de una de las legislaciones de referencia en la región, como es la ecuatoriana, lo ha permitido trasladar en acciones y resultados, por lo tanto, que han beneficiado directamente a ciudadanos ecuatorianos, ¿no? Además, hemos podido realizar obras de accesibilidad en la reconstrucción de varios colegios del país afectados por el terremoto de 2016 y toda esta labor ha permitido además que suba en la agenda de nuestra actuación de cooperación en el país el tema de los derechos de personas con discapacidad, y eso se ha visto reflejado en el nuevo marco de asociación país vigente, firmado recientemente y que incluye entre sus líneas específicas la educación inclusiva y los derechos económicos de las personas con discapacidad. En el caso de Paraguay, y a través de Bridging the Gap, hemos podido contribuir a la producción de datos accesibles sobre personas con discapacidad y la elaboración de indicadores, lo cual nos permite permite a las autoridades paraguayas disponer de unos datos sobre los cuales tomar decisiones fundamentadas. Además, hemos podido trabajar en el fomento de la educación inclusiva con la formación específica de profesores y profesoras y la dotación de recursos técnicos y financieros. Y hemos trabajado también con organizaciones de la sociedad civil de personas con discapacidad y acompañado procesos de incidencia y de participación en el diseño de políticas públicas, así como en la sensibilización de agencias de cooperación, facilitando herramientas para avanzar hacia una cooperación para el desarrollo más inclusiva en materia de discapacidad. Sin ninguna duda, uno de los hechos de los que nos sentimos más orgullosos es que en Paraguay Bridging the Gap ha contribuido de manera decisiva a que la SENADIS, la Secretaría Nacional para Personas con Discapacidad, se convierta en un actor clave de las políticas de inclusión de personas con discapacidad en el país gracias a sus actividades de fortalecimiento institucional y del sector. Y me gustaría terminar con una breve referencia al impacto que ha tenido la COVID a Bridging the Gap, ¿no? Porque si bien fue necesaria una reprogramación de una parte de las actividades, se encontró la vía para transformar la pandemia en una oportunidad y lograr que, por ejemplo, en el caso de los proyectos en Ecuador y en Paraguay, los proyectos contribuyeran a ofrecer información actualizada y accesible a las personas con discapacidad en ambos países en un momento crítico para conseguir que no fueran, una vez más, doblemente discriminadas, grandes olvidadas y cumplir, como decía anteriormente, con el compromiso de no dejar a nadie atrás y, desde luego, más que a nadie, a las personas con discapacidad con cuyo bienestar y derechos humanos estamos comprometidos. Muchísimas gracias, Federico.
Muchas gracias a la directora Castilla Ruiz de Velasco de la ETIT. Siempre me gusta retomar uno o dos mensajes al final de cada intervención, aunque no tenga realmente el tiempo, pero quiero agradecer en particular, más allá de recordar algunos mensajes que también la directora de FIAP recordaba, lo que indica cómo la cooperación española va alineada sobre los temas de la inclusión de personas con discapacidad. Quiero destacar el tema de la inclusión de género y de la doble discriminación que muchas veces las mujeres con discapacidad sufren. Gracias por aportar esta cuestión. Es un tema que hemos trabajado mucho en el proyecto en Ecuador, en Paraguay y también en los 3 países africanos, Burkina Faso, Etiopía y Sudán, y nos parece extremadamente relevante. Es un tema de que necesariamente se tendrá que trabajar y que la cooperación europea tendrá que tener en alta consideración en el futuro. Tanto el Gender Action Plan 3 de la Unión Europea como la nueva estrategia para inclusión de discapacidad de la Unión Europea consideran este tema como prioritario y es importante efectivamente que sigamos en esta senda. Así que muchísimas gracias a la directora Castilla Ruiz de Velasco por su tiempo. Sé que usted también creo nos tiene que dejar, pero muchas gracias por estar con nosotras y nosotros. Un placer. Pues seguimos con nuestra agenda y tengo el honor y el placer ahora de pasarle la palabra a la eurodiputada Mónica Silvana González. Eurodiputada, muchas gracias por estar una vez más con nosotras y nosotros. Le cedo la palabra por sus 10 minutos de intervención. Muchas gracias.
Hola, ¿me escuchan? Buenas tardes.
Sí, perfectamente, escuchamos perfectamente. Muchas gracias.
Bueno, muchas gracias, Federico Martini. Agradecer la reiterada invitación, ¿no?, por parte de todo el equipo de FIAP, especialmente a la directora, ¿no?, a Ana Terrón. Y bueno, me parece importante, después del foro que tuvimos el pasado 15 de abril, esta es una segunda oportunidad de Acortando Distancias 2, y que entiendo que hay que poner en valor el liderazgo de la Agencia Española de Cooperación Internacional. Lo comentaba antes Carmen Castilla, que no tengo el gusto de conocerla personalmente, pero tanto Ana como Carmen han hablado exactamente de la experiencia, ¿no? de lo importante que es el trabajar de forma interseccional, ¿no? También voy a compartir panel con ALESE, del Consorcio de Cooperación y Discapacidad, con los cuales venimos hace un tiempo desde el Parlamento Europeo intentando poner en agenda de la comisión donde estoy, la Comisión de Desarrollo del Parlamento Europeo, este tema, y creo que la nueva estrategia de personas con discapacidad 2021-2030 es una buena hoja de ruta en general. Pero a mí como parlamentaria obviamente siempre tenemos que pedir un poco más, ¿no? El Parlamento Europeo, de las tres instituciones, siempre tiene que ser, creo yo, enmendar al alza todo documento que nos llegue, ¿no? Por lo tanto, no me interpretéis esta intervención como una crítica, ni mucho menos, sino que siempre intento ser reivindicativa. Entiendo que la estrategia promueve los derechos de las personas con discapacidad de manera global, pretende que la Unión Europea refuerce su rol en esta lucha a través de instrumentos como la asistencia técnica, como los programas de financiación, también a través de un trabajo multilateral en conjunto con socios de otros países para implementar la Convención Internacional de Personas con Discapacidad, que por cierto nos evaluamos en el año 2022 y creo que debemos llegar con los deberes hechos, porque ese es el único acuerdo internacional que la Unión Europea como tal ha ratificado, ¿no? Y por lo tanto debemos llegar con los deberes hechos a este examen del año 2022. Sin embargo, yo creo que esta estrategia no vemos acciones concretas en lo que se refiere, por ejemplo, a reforzar programas como este, como Bridging the Gap, que tantos buenos logros ha conseguido y que empezó siendo un proyecto piloto y que en estos 5 países, al menos el que conozco un poco más de cerca, o que he estudiado un poco más de cerca, como Ecuador y Paraguay, lo de Burkina Faso, Etiopía y Sudán no lo conozco tan en detalle, creo que han funcionado bien y se ha podido poner el expertise europeo en la gestión de políticas públicas para las personas con discapacidad. Por lo tanto, creo que es un ejemplo de programa que debería ser capaz de extenderse a otros programas que tiene la Comisión, ¿no? Entiendo de que estamos en un momento crucial en la programación de todo este nuevo instrumento de cooperación al desarrollo y vecindad, como se indique. Yo estoy en Estrasburgo ahora y justamente en este pleno aprobamos la segunda lectura de este gran instrumento, pero estamos en la fase de los actos delegados, estamos en la fase de programación, donde entiendo que es el momento para todas estas cuestiones que tenemos pendientes de la parte de cómo se va a ejecutar, podamos meter e incluir la transversalidad necesaria para las políticas públicas destinadas a personas con discapacidad en este gran instrumento, ¿no? Yo me gustaría dejar algunas preguntas que son las que le hemos pasado a la Comisión y que en toda oportunidad que tengo con la comisaria seguimos insistiendo, que son cuáles son los planes de futuro, ¿no? Para incluir la cooperación internacional y la acción humanitaria en el trabajo de todo este compromiso que hay con la estrategia, ¿no? Específicamente para asegurar la coordinación efectiva entre las direcciones relevantes. Esto no es un trabajo de solamente la comisaria Dalli, no es un trabajo de la comisaria Debe, ¿no? Si hablamos de que tiene que ser transversal, necesitamos una coordinación entre las diferentes direcciones generales de la comisión, ¿no? Para dar cumplimiento al capítulo 6 justamente de esta estrategia, ¿no? Lo segundo, un plan de acción. Yo creo que deberíamos dejarlo más claro si existe una hoja de ruta de implementación clara, o mejor aún si existe la posibilidad de desarrollar un plan de acción eficaz donde podamos unir nuestros objetivos de cooperación al desarrollo a nivel europeo. Antes Carmen ha citado muy bien lo que ya está haciendo la ESI, la agencia española, sabemos también de las buenas prácticas de la agencia italiana, pero necesitamos una comunicación de la Unión Europea donde emita exactamente cuál es la hoja de ruta para unir estas dos políticas. También yo creo que es importante un monitoreo, que no está claro cómo se va a monitorear la implementación. e idealmente para todas las partes se debería estar en línea con la próxima revisión, como decía antes, de la Convención Internacional de los Derechos de las Personas con Discapacidad de la Unión Europea, que será el próximo año. También tendríamos que hablar más en concreto cuáles son, más que hablar, ponerlo en los actos delegados, ponerlo en la programación, cuáles las acciones definitivas para garantizar la participación significativa de las personas con discapacidad, tanto a nivel de las delegaciones de la Unión Europea en los países socios, ¿no? En este caso en Paraguay, estamos hablando en Ecuador, con Burkina Faso, y a nivel de la Unión Europea, y también de las organizaciones que están en Bruselas, que están en Estrasburgo, ¿no? Los datos, me preocupa mucho también que no esté claro cómo se apoyará a las delegaciones de la Unión Europea para comprender plenamente la situación de las personas con discapacidad en los países, en la práctica. Esto significa cómo se apoyará las delegaciones para recopilar datos desglosados con discapacidad. Habéis hecho mucha referencia acertadamente a la problemática de las niñas, mujeres y niñas con discapacidad. Necesitamos más datos para poder implementar políticas públicas más concretas hacia las niñas y mujeres con discapacidad. Entiendo que tenemos que asumir un liderazgo mundial, y ahí sí que me gustaría trasladar un mensaje muy concreto a los comisarios implicados, que qué compromiso concreto existe para que la Unión Europea sea un líder mundial utilizando la estrategia de discapacidad, y ya sabemos que somos líderes, somos el mayor actor de cooperación al desarrollo y de ayuda humanitaria, pero deberíamos serlo también en la implementación de las políticas públicas destinadas a las personas con discapacidad. Se han identificado oportunidades y eventos internacionales que la Unión Europea puede liderar, codirigir, apoyar, y que existen planes concretos para construir sinergias en otras estrategias. Me gustaría terminar ya, solamente... Sí, perdón, termino ya, un segundito. Me gustaría terminar, obviamente, apostando por un enfoque interseccional en relación con las desigualdades en países en desarrollo. Concretamente, si hablamos de un continente afectado por el COVID, es Latinoamérica, y lamentablemente yo creo que la respuesta que hemos dado desde Team Europe, que es un magnífico, ¿no? el instrumento que nos hemos dotado, pero sí me quedan algunas dudas sobre la distribución que se ha hecho de esta respuesta de COVID hacia Latinoamérica, dado que es uno del continente más afectado, con mayores muertes por COVID, y no tenemos datos desglasados de personas con discapacidad y las personas que han muerto en países, por ejemplo, como Perú, que es uno de los más afectados, ¿no? En definitiva, yo creo que lo relativo a la respuesta del COVID, del Team Europe COVID, no ha sido distribuido geográficamente, siendo la región más afectada. Por ejemplo, en vecindad hemos distribuido un 17%, en África un 30% y Latinoamérica solo un 6%, ¿no? Pero bueno, no es momento de hablar de esto, creo que estamos justamente poniendo en valor lo bien que han salido estos programas en los países en estos 5 países donde se ha desarrollado, y que nuestro compromiso como eurodiputados, nuestro compromiso como parte de la Comisión de Desarrollo es que estos programas que han funcionado puedan implementarse en otro, puedan empezar a implementarse en otro, y que cuenten con este expertise europeo. Creo que lo que ha comentado Ana, lo que ha comentado Carmen, la forma de gestión donde hay un elemento europeo que traslade el expertise es la fórmula que asegura que un proyecto funcione, no solamente a nuestros países socios, entregarles el dinero y que lo ejecuten ellos. Yo creo que el seguimiento de las políticas públicas que hace FIAP, que hace la agencia italiana, que hace la propia ESI, es el asegurarnos de que efectivamente los recursos públicos, los dineros de los contribuyentes europeos se destinan a a los valores que pretendemos, ¿no? Con los valores que pretendemos. Por lo tanto, creo que debemos insistir mucho más en un enfoque interseccional que nos lleve a considerar todos los factores junto a la vez, y cómo se cruzan entre sí, ¿no? De modo que podamos analizar adecuadamente el problema de la desigualdad y finalmente estar más informados para diseñar la respuesta más adecuada. Una estadística para ilustrar, como bien decíamos ya antes, una mujer con discapacidad tiene el doble riesgo de enfrentarse a la violencia doméstica, al acoso y a otras formas de violencia sexual y de género en comparación con otras mujeres sin discapacidad. Adoptar sistemáticamente un enfoque interseccional en el diseño de política es indispensable para aumentar de manera efectiva nuestro progreso hacia la eliminación de las discriminaciones y las desigualdades. nos hemos dotado de esta estrategia europea sobre los derechos de las personas con discapacidad y el plan de acción en materia de género, el GAP3, pero adoptar un enfoque interseccional requiere invertir en la recopilación, el análisis de datos desglosados, desarrollar un nuevo marco analítico, capacitar al personal, especialmente a nivel de las delegaciones de la Unión Europea, ¿no? Sabemos que hay un nuevo enfoque de manera de trabajar y que estos temas deben figurar en las prioridades de nuestros países socios, en la prioridad país de nuestros países socios, ¿no? Yo lo dejaría por aquí, agradeciendo nuevamente el gran trabajo, igual que ha hecho Ana. Esto no termina aquí. Tenemos que ser capaces, y cuenten con una aliada en el Parlamento Europeo, en la Comisión de Desarrollo, para impulsar, para presionar a quien haga falta para que estos programas continúen en los países que se están haciendo y extenderlo a nuevos países. Muchísimas gracias, y es un privilegio poder hablar de esto con tantas personas que saben tanto y que llevan tantos años trabajando. Mi compromiso a seguir haciéndolo junto a la sociedad civil, junto a las organizaciones como IDDC, como FIAP, como ESI, como la Agencia Italiana, y todo el ser estatal España, que tan buena labor realiza. Muchas gracias, Federico.
Muchísimas gracias a usted, eurodiputada. Verdaderamente completo y rica su intervención. No habría nada que añadir. Muchas gracias en primer lugar por su compromiso, por su dedicación y por su voluntad de, en fin, ayudarnos a que la semilla que hemos plantado a través de Bridging the Gap pueda seguir creciendo en el marco de las políticas de cooperación exterior de la Unión Europea. Creo muy importante destacar lo que usted también recordaba, o sea, este papel que el Parlamento Europeo tiene de vigilancia, control y de pregunta a la Comisión Europea sobre la acción que se están llevando a cabo en materia de inclusión de personas con discapacidad en los países de renta media y baja en las políticas de cooperación internacional. En este momento hace muchísima falta de liderazgo por parte de la Unión Europea toda, instituciones europeas y Estados miembros, para reforzar la cooperación inclusiva, y el papel del Parlamento Europeo en este sentido es clave y es de gran importancia. Y claro, pues muchísimas gracias de verdad por contar con nuestro apoyo, y a veces nosotros contar con el suyo, y por todo el apoyo que nos ha brindado a lo largo de estos años de trabajo. Ha sido un verdadero placer y le agradezco muchísimo su participación, y ojalá tengamos nuevas oportunidades en un futuro cercano de colaborar juntos. Muchas gracias entonces a la eurodiputada Mónica Silvana González. Le pido disculpas ahora a los intérpretes que cambio rápidamente al inglés, and I switch to English to introduce our next distinguished speaker of our panel. I have the pleasure and the honor to introduce Mr. Luca Maestripieri, Director of the Italian Agency for Development Cooperation, AICS. Mr. Maestripieri, the floor is yours. Grazie molte.
Grazie Federico, thank you for this opportunity, and good afternoon from Rome to all distinguished guests and participants. I will try to focus on how much the Italian development aid has been focusing on promoting and protecting the rights of persons with disabilities in more recent years. In line with the United Nations Convention, in 2010, the Italian Cooperation updated its guidelines on disability. And some years later, in 2013, we approved the Italian Cooperation Disability Action Plan. Later, in 2018, we adopted the guidelines for mainstreaming disability and social inclusion. And all these documents have been drafted with a participatory approach involving representatives of civil societies and organizations of persons with disabilities. Our more recent 3-year programming and policy planning document, which is the strategic document adopted by the Italian government on development cooperation, is correctly reflecting our commitment to pursuing the rights of persons with disability as a priority and a cross-cutting area of intervention, ensuring the inclusion of persons with disabilities in all our sectors of intervention. And also our plan for the effectiveness of cooperation interventions. We provide specific attention to persons with disabilities, as per the SDG principle, leave no one behind. And in the document, an increase of funding has been foreseen for 2021 and 2022 for interventions over disability. We continue to support the participation and consultation of organizations of persons with disability in our initiatives, reinforcing the empowerment of persons with disabilities that is essential to ensure their involvement in decision-making processes also in a mainstream way. In regard to this, since 2014, to capture information on mainstreaming disability projects, the Italian Corporation has inserted in its own general information system a specific marker for disability. And we are pleased to note that in June 2018, the DAC Working Group Party of Development Finance Statistics approved the introduction of a policy marker on the inclusion and empowerment of persons with disabilities. So the Italian Corporation has been the precursor for this code and collaborated in drafting the handbook OECD DAC policy marker on the inclusion and empowerment of persons with disabilities. Moreover, the inclusion of persons with disabilities in humanitarian action is one of the main priorities of our action, and in 2015, we approved a specific vademecum which explains why, but also how, to include persons with disabilities in humanitarian interventions. In 2016, we had no hesitation in supporting the writing of the Charter on the inclusion of persons with disabilities in humanitarian action and in committing towards its implementation at the Istanbul World Humanitarian Summit. Italy also welcomed the launch of the Interagency Standing Committee guidelines on the inclusion of persons with disabilities in humanitarian action, a document we consider of extreme importance to inform humanitarian workers on good practices to assess the needs of people with disabilities. On top of mainstreaming, the Italian Agency for Development Cooperation intervenes mainly in Africa and in the Middle East with a twin-track approach. On one hand, promoting initiatives that are specifically geared toward persons with disabilities in several countries, upholding their rights and taking into account specific needs and contexts. On the other hand, including persons with disabilities in all other projects whose main thrust is not specifically related to disability. Needless to say, persons with disabilities are disproportionately affected by the COVID-19 pandemic. This is primarily due to multiple intersecting barriers to health and other essential services, but also because stigma and discrimination are exacerbated in times of crisis. In our policy guidelines, a particular attention has been dedicated to COVID-19 response that is spreading rapidly around the world with devastating consequences on low-income countries, and an increase in inequity has been observed in the low-income countries where RICE is operating, especially in Africa. For this reason, the Italian agency recognizes that social protection represents one of the main determinants of an inclusive and sustainable development in line with the Agenda 2030, and considers lack or weak social protection systems as the main barrier that hinders a full enjoyment of human rights. We are delighted at the results of the Bridging the Gap project in all the countries involved. Specifically regarding Sudan, the transitional phase initiated after the revolution has created new spaces for participation to important reforms that will shape the future of that country. Within this framework, the commitment of the international community is essential to support Sudan in overcoming the numerous challenges hindering the reform process. The pandemic still heavily affects the population, and the dire economic situation are among the two main factors that mostly affect the population more at risk of vulnerability. In Burkina Faso, the adoption of national strategies for the rights of persons with disability and the related plans of action represent a step forward towards strengthening social protection systems. In our recent experience in Burkina Faso, the development of the strategy and its related plan of action become an opportunity for the National Council to disseminate information on the Convention and on existing national legislation. Transforming policies into practice, making access to rights a reality, is a major challenge for developing countries. The added value that the BTG project has been able to achieve with high-level partnerships should not be lost. The results gained demonstrate that working together with the involvement of all the stakeholders will maximize the impact towards the promotion and protection of the rights of persons with disabilities, particularly during this pandemic. In this regard, the involvement of the international community, and in particular the EU delegations, is strategic in aiming to provide a significant leverage for the partner countries. I point out that full cooperation with all stakeholders is a fundamental condition for inclusive development cooperation, and it is our intention to proceed in this direction. For all these reasons, we are willing to continue working with all of you, and we fully endorse the call of action for inclusion of persons with disabilities in development cooperation. Thank you again for this opportunity, and to all of you.
Thank you very much, Director Maestri Pieri, for your complete intervention as well, as much as the other panelists. I think, we all know that the Italian agency and the Italian corporation has a long-standing experience in terms of disability inclusion and have been working for disability inclusive cooperation for quite some time already. But I want in particular to highlight recently, besides the work you have done with us in Bridging the Gap, of course, which is brilliant and crucial for upholding the rights of persons with disabilities in Burkina Faso and Sudan. But I want in particular to highlight the efforts that you have done to implement the dark marker, first an Italian marker within the agency, and then the dark marker and in your own work. It is one of the most important recommendations all organizations of persons with disability push forward and ask donors to consider in their work. The Italian agency has spearheaded change in this sense and has been one of the first agencies to adopt the marker. Definitely something to be proud of, and that will surely make the Italian agency improve more and more over time in inclusion of persons with disabilities in international cooperation. So thank you very much, Director Maestri Pieri, for your intervention and for your time and for sharing your thoughts with us. Again, grazie molte. I have now the pleasure to move on our next panelist for today, representing the Austrian Development Agency as head of unit countries and region, Mr. Walter Hemmeyer. I hope I have pronounced your last name correctly. If not, my apologies. Thank you very much for being with us. Mr. Hemmeyer, the floor is yours.
Hello, Federico, and thank you. I hope you can hear me well.
Very well, loud and clear.
Great. A good day to all the fellow panelists and participants from Vienna in Austria. It's a great pleasure for me today to speak at this final conference of Bridging the Gap on behalf of the Austrian Development Agency on our perspectives on inclusion and our experiences with the BTG project, particularly in Ethiopia. Let me start by thanking the European Commission for the opportunity to participate in Bridging the Gap, FIAP for its excellent leadership, and all the consortium partners for the great collaboration over the past years. We are convinced that if we want to achieve the SDGs, if we really want to leave no one behind, the inclusion of persons with disabilities in our activities is inevitable. After all, 15% of the world population, or more than 1 billion people, live with some form of disability. and 80% of them live in developing countries, and usually they belong to the poorest parts of the populations. For the Austrian Development Agency, Nothing About Us, Without Us has indeed served as a guiding principle for inclusive development. I am confident that we have made good progress towards meeting the requirements that are also outlined in the call for action on disability inclusion. Austria's Federal Act on Development Cooperation of 2002 requires development measures to take into consideration the needs of persons with disabilities. So right from the beginning, ADA was obliged to strive for inclusive development. Based on this legal act, we gradually adopted quality principles to address these needs. After Austria's accession to the UN Convention on the Rights of Persons with Disabilities in 2008, the inclusion of persons with disabilities in our activities received a new dynamic and led us to upgrade our inclusive measures, processes, and instruments. The Austrian government adopted a national action plan on disability in 2012, and ADA participates in the reporting on it. A new plan up to 2030 is currently in preparation, and recommendations from the BTG assessment as part of the project will be integrated into this new plan. The Austrian Development Cooperation, in a larger sense, applies the human rights-based approach to development with the very relevant principles of equality and non-discrimination, participation, empowerment, and accountability, therefore addressing the issue from a rights perspective. ADA has been financing and implementing specific projects in support of the rights of persons with disabilities and developing tools to mainstream disability in projects and programs. Therefore, this twin-track approach has become part of our DNA, or at least that is the intention. Key tools for this are a handbook on the inclusion of persons with disabilities and a system for environmental, gender, and social impact management. In order to exchange ideas and experiences and to learn from others, particularly disabled people organizations, we established a working group on disability in which relevant ministries, CSOs, and think tanks are represented. And since 2019, ADA has applied the OECD DAC disability policy markers, which we also have talked about just now. So much has been done, but of course more has to be done within our own structures and in our partner countries. The situation is particularly harsh in many sub-Saharan countries, like Ethiopia, where we have been implementing one component of bridging the gap. 95% of the people with disabilities in Ethiopia live in poverty. Probably we will have to say in extreme poverty. Due to misconceptions and stereotypes, they are still largely seen as unproductive and unable to contribute to society in a meaningful way. They are frequently deprived from both civil and political, as well as economic, social, and cultural rights, and from employment and social services. While Ethiopia has ratified the UN Convention, a big gap in implementation still remains. The project in Ethiopia focused on inclusion in the livelihood sector with the aim to improve resilience. It included working with ongoing programs implemented by various other partners, such as UN agencies or CSOs like CARE Ethiopia, and to make these programs more inclusive. After more than 3 years now, many objectives have been achieved. With respect to institutional strengthening of both government and organizations of persons with disabilities, the project managed to, and I name some examples, support the government to draft its implementation report for the convention, sensitizing government institutions for more inclusion, through mainly supporting the OPDs, contribute to the elaboration of the National Disability Act and the establishment of the Disability Directorate under the Ministry of Labor and Social Affairs. Help restructure or establish systems for a disability inclusion focal point on regional levels, such as in Amhara and Somali regions. Develop organizational capacities of umbrella OPDs at both federal and regional levels. Water points and latrines in schools built by CARE Ethiopia are now accessible to persons with disabilities, and disability mainstreaming was included in various CSO manuals in local language. In order to contribute to more inclusive development partners, the project supported country offices of the World Food Programme, UNDP, or ADA itself by trainings and guiding materials. In the 2 remaining months, the project will focus on sustainability by further building institutional capacities. Only some days ago, we launched an external evaluation of the project's achievements and potentials for future engagement. ADA will also continue implementing the recommendations to make our own processes more inclusive, for example, with online training modules. It may be too early to state whether BTG in Ethiopia has been a success in terms of impact. We are confident, however, that there is an increased awareness of key actors like the Line Ministry on important aspects such as the rights-based approach and the need to coordinate and network to push the agenda further. With a law and a Directorate for Disability, framework conditions crucial for more inclusions were established. These developments are promising to ensure that persons with disabilities are not, or at least less, left behind in an environment with very limited services, harsh climate conditions, and challenging terrains, in which they are usually the last ones to benefit from services and programs. It is now in the hands of the government of Ethiopia to pursue this path. We also strongly believe, after this experience and with many others, in multi-donor actions promoting inclusion, like Bridging the Gap. They foster more inclusion, more coordination and cooperation among donors. They take into account comparative advantages, and therefore they contribute to more effectiveness. In order to ensure sustainability, ownership in the partner countries and in our own institutions is crucial. To conclude, if we really want to achieve the SDGs and leave no one behind, we need more such initiatives. By participating in the project, we hope to have made at least a small contribution, and we are available for further efforts. Thank you.
Okay, sorry, I was speaking with my mic off. Thank you very much to Walter Hellmeyer from the Austrian Development Agency. Again, another very important intervention, I think. Thank you for recalling some of the results that Bridging the Gap has obtained in Ethiopia. I completely agree with you. It's still too soon to call for the impact of the project, but I think that some results are already incipient, as you were mentioning, and it is very important now that the national institutions, the multilateral organizations, and the other donors, everybody, and of course the organization of civil society, continue on the work, continue watering the plants, so for the forest to eventually build and grow. What I think it's very important of what Mr. Hema has said is the reference to the multiplier effect that some work of Bridging the Gap has obtained through working with other partners operating in Ethiopia. You have to remember that our project is eventually relatively small in scale and budget, and we do not have the capacity to, have such an enormous impact on a country such as Ethiopia that is affected by very by extreme problems as poverty. The data you recall on poverty are quite self-evident. But by working with organization of the United Nations, funds and programs, other donors and other operators and development cooperation practitioners such as CARE, we have obtained greater results that they would have obtained alone. And this has been the force that has moved Bridging the Gap in Ethiopia, thanks to the work of the Austrian Development Agency, which has put another block in the wall of disability inclusion, the disability inclusions bridge in its work. So thank you very much to Mr. Hema for his intervention and his word. A true pleasure. Also, thank you for reminding again the OECD dark marker and for making a reference to our call for action that will be presented in a short while. Thank you again, Mr. Hema, for your time. Before moving to our last but not least speaker, I also thank again the director of the Italian agency, Luca Maestri-Pieri, who has now to leave us. But thank you again for being with us and for your time today. And now, with no further ado, I have the pleasure to introduce Mette Müller-Christensen from the International Disability and Development Consortium, IDDC, Vice Chair of IDDC. Mette, the floor is yours. Thank you very much.
Thank you very much, Federico. And good afternoon, good morning, good evening to all of you listening in today. And thank you for the opportunity to speak on behalf of IDDC today, IDDC being one of the partners of Bridging the Gap project. The International Disability and Development Consortium, IDDC, is a grouping of approximately 30 civil society organizations, including international NGOs and OPDs. And I am one of two vice chairs in IDDC, where I represent Disabled People's Organizations Denmark, the Danish umbrella for OPDs in Denmark. It was a pleasure to attend the seminar yesterday to hear on a more technical level the results and outputs, and today also from my fellow panelists, how the various partners and agencies have benefited from participating in this project and the effect the project has had on making new initiatives and thus working towards ensuring development programs are more disability inclusive. It's really thrilling to hear how the project, how much the project has generated. For IDDC, the project has a significant importance in terms of practically developing, implementing and monitoring disability inclusive sector policies and services for realizing the CRPD, focusing on data collection, social protection, employment and gender, and education, livelihood, and health. IDDC has relentlessly been advocating for more and systematic disability inclusion in the EU through IDDC members that are mobilized in the dedicated EU task group. And while the inclusion of persons with disabilities has gained some political momentum and support by commissioners in place, many challenges remain both at policy and at operational levels in headquarters and within the EU delegations. And as the title for the conference today is also the way forward, then let me say that from IDDC side, we are very curious to hear what the European Commission plans to do beyond the end of Bridging the Gap project to move disability inclusion forward in its international cooperation and international partnerships. And also, how will the EU and EU member states work in and with partner countries to move from policies to concrete action? We've heard today and yesterday from some champions, but not all development agencies are as far ahead as, for example, Italy, Spain, and Austria that we have heard from. So this will definitely have IDDC's attention moving forward. And yesterday, my colleagues from IDDC presented some of the key asks that we have, and allow me to repeat some of what was said yesterday. The EU needs to clarify what meaningful participation means and how it should be translated into concrete measures. Meaningful participation cannot be solely reduced to consultation of OPDs on policy documents. OPDs must be enabled in the role of project implementation, being partners there involved in planning, implementation, monitoring of EU programs that concerns them. Another key point is that disability inclusion should systematically be mainstreamed in all of EU external action policies. There is, for example, a gender action plan, the Africa-EU strategy, and so on. Disability inclusion must be mainstreamed in these policies. Another key thing that is not just for EU, but is a general thing. We really need to do a lot to produce, collect, and analyze inclusive and intersectional data. And the data must be disaggregated by at least gender, age, and disability. I was happy to hear the former speaker talk about the DAC disability marker, which is a great tool. We also have the Washington group set of questions. We have human rights indicators and so on. And what remains is that disability disaggregated data remain a key part in the fight against invisibility. Without the numbers, it's difficult to measure inclusion and it's difficult to measure progress. A fourth key point is that the EU aid programming exercise must result in fully inclusive and CRPD compliant programs. The programming exercise is the process by which the EU delegations are discussing where and how to allocate the EU aid in the partner countries. This year, many rules have changed as we have a new single financial instrument called Global Europe. And the EU must ensure that no EU aid will be spent on any action that maintain or worse, or even worse, reinforce barriers to the inclusion of persons with disabilities and the realization of their rights. Finally, and I was happy to hear from the Member of Parliament earlier today, really the EU should champion disability rights globally in a consistent manner and apply its leadership where it is the greatest added value to generate substantial changes. So positively, in the new EU disability rights strategy, there's a chapter on external action of the EU that largely focuses on the new ambition for the EU to become a champion advocate of disability rights on the global scene. And this is just great. And then it comes back to from policy to action. An immediate and powerful sign of this leadership would be to strongly promote the rights of persons with disabilities in the global discussions relating to access to COVID-19 vaccination, and in general globally to the COVID-19 response and recovery plans. We'd also like to see more of the EU in disability sector initiatives like the Global Action on Disability Network, the GLAD network, which I noticed that Anna also mentioned in the beginning, and how much FIAP is getting out of participating there. And then from IDDC side, we also hope to see EU involved at the highest level in the next Global Disability Summit that will take place in February in Norway. And maybe the EU should even be a co-host for a future summit. That would really mean championing disability rights globally. I'd like to encourage you to sharpen your pencils or your laptop keyboards when Nadia Haddad will present the call to action from Bridging the Gap. I'm showing the document here. At the end of the conference today, I heard some endorsements to it already. This highly overlaps with the key points that I have been highlighting in this presentation. Thank you all for listening in, and also a warm thanks from me, from IDDC, to the whole Bridging the Gap team. Thank you very much.
Thank you very much, Mette, for your intervention. Through you, I want to thank IDDC, as well as ETF, the other technical partner, the other organization of persons with disability in the part of our consortium. I've said it yesterday and I repeat it today. Without EDF and IDDC, this project would have not existed, plain and simple. Your role has been crucial throughout the implementation and before it, even in the phase of defining the document of action and to putting forward an advocacy for Bridging the Gap. And your role throughout the project has been paramount to the results, to obtaining the results. And also, I want to highlight, I mean, there are many messages, Mette, you have put forward that are worth highlighting, but I think it is very important to couple your message with the one from the MEP Monica Gonzalez, who also called, as you did, the European Commission to its own responsibility. And what comes next now? We actually called this conference the way forward. We need to think ahead, to look forward and to see what's next going to happen. Our cooperation agencies, the partner of Bridging the Gap, have proved already their will to continue in the journey they have embarked 4 years ago. And I hope that this call that comes from all sides will be somewhat heard in Brussels as well, and we can continue on this path together. I think it is very important, I repeat again, that the EU show the leaderships that we all hope for ahead of the Global Disability Summit and ahead of times of great challenges in terms of post-COVID recovery, vaccination rollout, fight to climate change, just transition, etc. There's much on the table that needs to be considered. And thanks to you, Mette, and IDDC for reminding us to the obligations enshrined in the CRPD. So with this, I would conclude this first panel for today. I'm very thankful to all the panelists, all the speakers that have intervened for your very insightful and interesting interventions. I hope that all the participants have enjoyed the presentations and learned, or at least taken away something from it, and for the future of inclusive cooperation, for the future of disability inclusive cooperation. We can now move on relatively quickly onto the next block for today's conference, which is a quick restitution of the results of yesterday's seminar, a technical seminar dedicated also to the topic of disability inclusive cooperation. So again, it will be myself and my colleague Alessia Rogai who will give you a brief overview of what have been the main result. So Allow me just to share for 1 second. Here it comes, and I hope you can see now my screen. Confirm it, please. You can.
Yes, yes.
Thank you, Alessia. So we'll just go through a very quick overview of what the main results of the 2 panels yesterday were. Very briefly, we had a first panel dedicated to the so-called Bridge the Gap effect and how the project has impacted the partnership's approach to disability inclusive development. The speakers and representation of the project consortium highlighted a few aspects that Bridging the Gap has helped the organization through in implementing better and more effective disability inclusive policies, programs, and projects. Our first speakers was Peggy Martinello from FIAP, head of Unit of Public Administration and Social Affairs, that stated that Bridging the Gap has represented a before and an after for FIAP in terms of disability inclusive development and in terms of understanding the importance of disability inclusion in its work, not just as such, but also in reference to the international framework that the CRPD and the SDG gives, and of course with a particular attention to intersectionality and to multiple forms of discrimination. Bridging the Gap has also helped FIAP reinforcing alliances with other actors of the Spanish cooperation system, not just AECID, of course, but also civil society organizations and organizations of persons with disabilities that have been active in disability inclusive cooperation for already some years now. She also highlighted the importance of the multi-partner approach, which she called a way forward, an innovative way forward in international cooperation that is here to stay, where institutional partners join civil society to achieve results. And finally, she reminded some of the internal response that FIAP has given to some recommendations gathered in a dedicated Bridging the Gap report to enhance the capacity to respond to disability inclusive cooperation's challenges and be a more proactive partner of the GLAD network. After that, we had the pleasure to listen from Georg Huber-Gaberwachter, advisor for EU-funded projects of the Austrian Development Agency, who reminded the solid legal and programmatic framework for disability inclusion of the Austrian cooperation that includes integrity officers, a code of conduct, and regular trainings to ensure no discrimination and promotion of the rights of persons with disabilities in the work of ADA. In particular, he highlighted the importance of the integration of the principles of inclusive development in project cycle management through a dedicated disability working group, attention to procurement, and the help of external advisors that eventually was embedded in a dedicated handbook for disability inclusion in the work of ADA. However, he stated very clearly and openly that it's not easy to turn theory into practice, something that we have heard also from other speakers. So that's why ADA has been focusing on training, aiming to institutionalize them and to have a solid HR basis to work upon and build its capacity to respond to disability inclusive cooperation challenges. Among the main difficulties or challenges he mentioned, definitely a sort of mainstreaming fatigue from the colleague of the Austrian agency, cross-cutting conflicts that exist between different topics that need and are worth cross-cutting, and of course, a matter of resources. I think some elements that can be shared by many development cooperation practitioners. We then listened to Miriam Tiscarblat from AECID, the Spanish Agency for Development and Cooperation, head of sectoral programs. She also recalled the commitment to inclusion that the Spanish cooperation has had to the CRPD since its early years. And she reminded the importance of the moment for Spanish cooperation approaching, due to the recently approved new Spanish strategy for external action and the upcoming new Plan Director, the master plan of the Spanish cooperation, and a new cooperation law. In all these elements and documents that we've represent the founding pillars of the next years of the Spanish cooperation, the focus on disability and the focus on inclusion of persons with disability is and must be clear, and that's an important step forward. And of course, she recalled intense collaboration with several Spanish actors of the civil society, something that has definitely reinforced the capacity of ICID to respond to disability inclusive challenges, with the 22 organizations of persons with disability supported, with particular focus on Latin America in the recent years. And she also recalled the importance of the GLAD network, something Peggy before her reminded as a space, a safe space to discuss and learn on good and best practices of disability inclusive development, and to push forward an agenda for inclusion of persons with disabilities in international cooperation. Milano Muscio, focal point disability inclusion of the Italian Agency for Development Cooperation, AICS, reminded the audience how Italy has always been at the forefront of the protection and promotion of the rights of persons with disabilities. And I recalled some of the main results obtained by AICS through bridging the gap in Burkina Faso and Sudan. She also put under the spotlight the added value that bridging the gap has represented for the Italian agency. A project that, in her words, brought together European partners and civil society organizations that in this way can enrich the entire process of design, implementation, and evaluation of projects. She also looked ahead onto the future, on the way forward, asking and calling for a focus on longer-term impact to continue this work in partnership, reinforce bottom-up approach, and preserve the bridging the gap experience. Last but not least, Marion Steff from the European Disability Forum, International Cooperation Manager, different kind of partner, of course, such as IDDC, reminded us EDF's primary focus is on the rights of persons with disability in the European Union. But through their work, they noticed that Article 11 and 32 of the CRPD relating respectively to humanitarian action and international cooperation were somewhat overlooked by the EU institutions. From these, the need, the will to engage in new initiatives for inclusive international cooperation. Some initiatives therefore started, including Bridging the Gap, and these went along a growing demand from the partners and members of EDF. This implied a need for designing a fully fledged strategy that they put forward between 2018 and 2019, which roughly had 5 main objectives: to reinforce advocacy vis-a-vis the EU institutions, strengthen the members' advocacy capacity, advocate for evidence, also for data-driven international cooperation, and to reinforce the role of organization of persons with disabilities in international cooperation for political, legal, technical, functional, and policy work reasons she explained in a very detailed manner. And finally, to push forward an agenda for innovation and learning in disability inclusive international cooperation. So here's some elements from panel 1. With no further ado, I leave the floor to my colleague Alessia to present the results of panel 2.
Thank you very much, Federico. It was very good to realize through the work of our partners and their appreciation for the project that Bridging the Gap will leave an important, I think, legacy, having stimulated and greatly expanded the discussion on disability. Also, some of the activities presented in the second panel showed that the coordination of Bridging the Gap certainly played an important role, especially with regards to strategic collaborations, because we can say, I think, one of the biggest success factor of Bridging the Gap is precisely the ability to bring together different key actors and make them collaborate. And in this case, I would say all the actors that interested us, so donors, local and international public institutions, local actors, OPDs, civil society organizations. And this type of cooperation not only works, but from a knowledge management point of view, it empowers these actors and make them growing together. The example of Sudan is very interesting, not only for the way that the group was born, that is definitely a good practice. A request started from the bottom, intercepted from the top, from the political level, and finally implemented by all the actors. But the example of the group of friends is much more interesting for what it can do in the future, precisely on the basis of this peculiar multi-stakeholder structure. They created indeed an important space for participation, for promoting the rights of persons with disabilities and sharing experience that for sure can have a strong impact in the future. Also, the initiative Morocco on inclusion of women and youth with disabilities through the employment in the tourism sector is a good example of strategic collaboration. Indeed, the initiative is implemented by different actors, ONCE, IC, the Spanish cooperation, but also private and public sector. And ONCE expanded its activities on women and youth with disability also in Morocco, giving an inclusive approach to the tourism sector, but also by addressing South-to-South cooperation and exchange of best practice in this important sector. Important information has also been shared by NORAD regarding the next Global Disability Summit that will take place in 2022. It will be fully virtual, and there will be a civil society segment organized by the International Disability Alliance and Atlas International. The summit will build on the success and commitments from the Global Disability Summit in 2018 in London, but also recognizing the context and the new challenges emerged in the last year in terms of how we approach disability inclusion. The goal will be to set inclusive development by moving policy to action and accelerate progress for inclusive development. Always in terms of strategic coordination, also IDDC highlighted the constructive collaboration between Bridging the Gap and the IDDC EU task group to support the policy-making process of the EU external action. IDDC works to promote greater inclusion in the European Union's international cooperation by asking to prioritize actions in the future, such as the needs of meaningful participation of organization of persons with disabilities and how it will be translated into concrete measures, but also the EU-ED programming exercise that should be fully inclusive and CRPD compliant, and also the EU should enhance its capacity and coordination for the promotion of disability rights in its external action, as also raised today by our panelists. So, well, thank you very much to all the contributors of this second panel. I leave the floor again to my colleague Federico Martiri to introduce the last part of the conference and the call for action. Thank you very much. Thank you very much, everybody. Thank you, Federico.
Thank you, Alessia. That was very insightful. Well, these help us bridging between what the first panelists have said during their intervention and what Nadia Haddad, board member of the European Disability Forum, will present in a very short while. So the call for action that Bridging the Gap has put together with EDF and IDDC on disability inclusive cooperation. Just for your information, this is the third capitalization conference Bridging the Gap is organized, and also in the previous two dedicated to inclusive social protection in Africa and data for inclusive education in Latin America, respectively. We concluded by presenting two dedicated calls for action with the African Disability Forum and Riyadh's, respectively. So since we're a little bit late and I do not want to waste your time further, I have the great pleasure to leave the floor to Nadia Haddad for her presentation. Thank you, Nadia.
Thank you, Federico, for giving me the floor, and thank the organizers for having EDF as partners since the beginning. That shows really a meaningful involvement for our side. So to be briefly, EDF is an umbrella organization with more than 100 members spread over all Europe, defending more than 1 million people's rights within the European Union and now also through external action. And so today I will present the Bridging the Gap call for action that has been developed by IDDC EDF with the support of the EU-funded initiative Bridging the Gap colleagues. Wherefore, a big thank you. And so why this call for action? First of all, we heard from everybody already that have been previously spoke that the European Union and every member state of the Union ratified the UN Convention on the Right of Persons with Disability. They adapted this year the European Strategy on the Right of Persons with Disabilities 2021-2030 as framework for the CRPD implementation. And then the third part is that the European Union and the member states all together are the largest donor of international in the world. So they all have the responsibility to ensure that all their policies and programs related to external action and international cooperation are disability inclusive and in line with the CRPD, including the implementation of the Agenda 2030 and its Sustainable Development Goals. Okay, you want to use the... Okay, thank you. You can go to the next slide, please. The next one, please. So this action, so the Bridging the Gap call, the European Union and all the member states on realizing these 12 points that I will now see, that we agree all on it due to experience of the 4-year Bridging the Gap project. So the first one is to implement and promote policies and programs which are human right based, inclusive and accessible to persons with disabilities, and that they're all in line with their obligations under the international law, including the CRPD and the SDGs. The second point is to put in place concrete disability inclusive strategies and action plans to move from inclusive policy to inclusive actions. So all the existing policies, frameworks, and action plans, including but not limited to gender equality, rights of children, rights of immigrants, internally displaced and refugees, and so on, it should be revised to really reflect the disability inclusion. The third point is to demonstrate leadership to promote the rights of persons with disabilities, actively engage in the global action of disability, so the GLAD network that we already heard previous speakers are mentioning, as well as in the next Global Disability Summit in Norway in 2022 February. Next slide, please. So the fourth point is really to ensure that across all sectors, all external investments and donor-funded actions for international development uphold the principles of accessibility, dignity, and inclusion of the most marginalized group, including persons with disabilities in the community. So no funds should be invested externally in creating or exacerbating barriers or segregating or institutionalization of all persons with disabilities. So the fifth point is to ensure meaningful engagement of the DPOs, including marginalized and underrepresented groups, explicitly mentioning DPOs' engagement with the development practitioners, and including all the European delegations, the European member states, and the disability coordination and the focal point at EU level, but also at the country level. Next point, please. The sixth point is to provide regular training and capacity building for the development practitioners, staff, including the European delegation and field staff, but also the European member state agency in the partner countries, the disability coordinators, and the focal points on the implementation of the CRPD and the disability inclusive programming to be sure that they're all in line and with the CRPD. So the seventh point is to improve disability mainstreaming in all key policies and guidance so that they provide clear guidance and training on disability mainstreaming across all the sector. So it must be a multi-stakeholders approach. The eighth point is to apply a twin track approach, we hear it also today, to the disability inclusive in the development, which consists of on one side, mainstreaming the right of all persons with disabilities in all the programs, and on the other hand, to develop initiatives specific for or by persons with disabilities according to the needs and extra support that they need. So the ninth point is to conduct the systematic collection of this greater data by disability. Next slide, please. So the 10th point is at country level, coordinate analytic work, interventing strategies and consultation space within the European actors, as well as other multilateral and bilateral development partners, respecting each country's policies, space and leadership to democracy, defining the national disability strategies. And this all should be in line with 8 effectiveness principles as defined in the procedural commitments of the SDG number 17. So the 11th point is to implement the OECD DAC disability policy marker to track development finance and support of persons with disabilities. And the last point is very specially in response to the COVID-19, promoting the rights of persons with disability and the global discussion relating to the access to COVID vaccination and more globally to the COVID response and recovery plans to really build back better. So I will end up by really encouraging you to consult the website of Bridging the Gap, where you can find also an easy to read version of the project itself to make it accessible for those who couldn't follow today, which we need to apologize for it. And also you will find complete information about all the outcomes and the successes for this 4-year project. And finally, I would end up by thanking you, and don't hesitate if you have any question to contact us or IDDC or one of the the staff who were involved with us since the beginning and all the other potential stakeholders. So thank you very much. And I hope that together we can make this call and all the actions related to it a reality for all persons with disabilities. Thank you.
Thank you. Thank you very much, Nadia, for presenting the call for action. Thank you for making it put it very simply and clear for everyone. The effort we have done together with EDF and ITTC and the other consortium member was to try to summarize a little bit of work we have conducted over the past 4 years. And of course, this call for action is not binding, does not have it's not a legal obligation for anybody, but we hope it can support and incentivize new and better actions for disability inclusive cooperation in the near future. We have already heard some endorsements in the previous interventions, and I hope that more can join these endorsements and make it become reality. We have plenty of strategies out there, plenty of interesting initiatives, and I know that EDF and IDDC are fully available to support development cooperation practitioners to make their own actions fully disability inclusive. So thank you again, Nadia, for your work. Thank you, EDF. Thank you, IDDC, for your hard work throughout these 4 years. And yes, you will find all these materials and more on our project website. The call for action will be soon published in English, French, and Spanish as well. This concludes our virtual capitalization conference, Disability, Inclusion in Development Cooperation, the Way Forward. We're a little bit late. I apologize with interpreters and the captioners, but I cannot conclude this conference without saying a big, enormous, gargantuan thank you to everybody that has been involved in this project. This is our final capitalization conference. However, don't forget to join us on Monday, June 14th, the side event Beyond Bridging the Gap for Inclusive Policies to Community Inclusion, a side event to the 14th Conference of the State Parties of the UN Convention on the Rights of Persons with Disability. You can find all information on our project website. and social networks as well. But yes, this concludes a cycle of conferences, of hard work, and you see just, you know, the visible face of the conference, of the calls and everything else, but there is a lot of work behind that. And for this, I have literally no words to express my gratitude to each and one of the persons that have been involved in the work of Bridging the Gap. I'm not going to mention it, but of course, I'm just going to say thanks. I'm sorry, just hearing somebody speaking in the background, but no big deal. Thanks, everybody. Thanks to all our speakers once again. Thanks to the consortium members. Thanks to the European Union. And thanks to all the attendants to this conference. I hope you have enjoyed it. Stay tuned, the more to come until the end of the month, and in particular on Monday at our side event. Until then, so long, take care, and see you on Monday, I hope, everybody. Bye-bye, thank you.
Thank you very much.
Thank you. Thank you. Thank you, bye.